Getting ready for gastric bypass surgery. You will need to go shopping for a few things to have on hand prior to surgery. Over-the-counter medications and supplies. Hibiclen's antibacterial soap, which is available at any pharmacy. Tylenol or acetaminophen gel caps. Imodium, Gas-X, and milk of magnesia. Vitamin supplements that you will need are BE Nutrition multivitamin with iron that are available at our offices, sublingual vitamin B12 1000 microgram, calcium citrate with vitamin D. Groceries. Here is a list of suggestions for the early phase after surgery. Please refer to the gastric bypass post-op nutritional handout for additional information. All BE Nutrition products are sold at our offices. Clear liquids such as water, clear broth, unsweetened tea, Crystal Light or flavored water, sugar-free water enhancer, sugar-free Powerade or Gatorade, sugar-free Jell-O, sugar-free popsicles, protein water, BE Nutrition fruit drinks or broth, which contain 15 grams of protein. These may also be used for the clear liquids on the day before surgery. Full liquids such as BE Nutrition cream soup, which contains 15 grams of protein, BE Nutrition protein shakes or pudding, any flavor, which contain 30 grams of protein, unsweetened soy or almond milk, Fairlife skim milk, fat-free Jell-O pudding, low-fat Greek yogurt, blended flavor, no fruit chunks, and less than 100 calories. 98% fat-free cream soups, which must be strained, and no sugar-added natural applesauce. You will see your surgeon for a consent visit in the few weeks prior to surgery. During this appointment, the procedure will be discussed in detail with you, and you will sign your consents for surgery. Your final questions will be answered, and the risks and benefits of the procedure will be reviewed. Risk of complications will also be discussed and will vary according to an individual's health status. We encourage you to bring your significant other or a family member with you to this appointment. They should be aware of what is to expect as well as and may have additional questions for the surgeon. The following are possible early complications that may occur with any abdominal general surgery. These complications may require hospitalization and additional surgery. Infection, bleeding from injury to surrounding organs, pneumonia, deep vein thrombosis, which are blood clots in the legs, pulmonary embolism, which are blood clot in the lungs, intestinal obstruction, which is usually due to the development of hernias or scar tissue, dehydration, or death. Additional complications which may occur in the first few weeks following weight loss surgery include gastroesophageal reflux, or GERD, and staple line leak. Staple line leak may also require hospitalization and additional surgery. The following are possible late complications that may occur 6 weeks or more after surgery. Hiatal hernias, which is part of the stomach slips up and passes through the diaphragm into the chest. Other hernias. Gastroesophageal reflux disease, or GERD. Intestinal obstruction. Gastric ulcers and bleeding. These risks increase with tobacco use and certain medications. Osteoporosis, which is related to dietary intake, weight loss, and menopause. Gallbladder disease, which is related to weight loss. Flare-up of gout and kidney stones, which can be related to inadequate liquid intake. Poor weight loss and/or weight regain. The surgeon will also review your medication list on this visit. You may be asked to speak with your primary care physician and/or specialist physician, such as a cardiologist, prior to stopping or changing any medications before surgery. The following medications will require specific attention. Non-steroidal anti-inflammatory drugs, or known as NSAIDs. These medications should be stopped 10 days before surgery. They include, but are not limited to, Advil, ibuprofen, Motrin, Aleve, and Naproxen. Steroids. These may need to be stopped, but should be discussed with your surgeon and primary care physician first. This includes medications like prednisone. Blood thinners. These medications should be stopped 1 week before surgery. They include, but are not limited to, aspirin, Coumadin, Plavix, Brilinta, Eliquis, Xarelto, Pradaxa, Agrinox, Persantine, and Ticlid. Vitamin E. Some supplements, such as vitamin E, can cause thinning of the blood and should be stopped 1 week before surgery. Hormones. Women taking oral contraceptives to prevent pregnancy or oral hormone supplements after menopause must stop them for 1 month before and after surgery. Women will need to use alternative forms of contraception to prevent pregnancy. Diet pills. These medications should be stopped 2 weeks prior to surgery. They include, but are not limited to, phentermine, Adipex, and Lomera. Other considerations that may be discussed on this visit include: if you have been diagnosed with obstructive sleep apnea, you must use your CPAP or BiPAP for at least 2 weeks before surgery. If you are still smoking, you must quit at least 2 weeks prior to surgery. Visit the BE Nutrition store while you are at the office and purchase required nutritional therapy products that you will need for your first few weeks after surgery. Following the consent appointment with your surgeon, the scheduling office will contact you to schedule your pre-op registration at the hospital, surgery date, and your first post-op appointment at our clinic. Factors such as your schedule, surgeon, and operating room availability will be considered. Thank you.